Imagine a virus so dangerous that entire villages shut down, hospitals became battle zones, and people were afraid to even touch their loved ones. This is the story of Ebola, one of the deadliest viruses known to mankind. And today, we're breaking down exactly how it spreads, what it does inside the body, and why doctors fear it so much. Ebola virus disease is a severe and often deadly illness caused by the Ebola virus. It was first discovered in 1976 near the Ebola River in Central Africa. The virus is believed to come from infected wild animals like bats and primates before spreading to humans. Some outbreaks have had death rates of up to 90%. That's why Ebola quickly became one of the most feared diseases on Earth. Ebola spreads through direct contact with blood, vomit, sweat, saliva, urine, other bodily fluids from an infected person. It can also spread from contaminated objects like needles or hospital equipment. Unlike some airborne viruses, Ebola does not usually spread through the air like the flu. But once symptoms begin, the virus becomes extremely contagious through body fluids. That's why healthcare workers wear full protective suits when treating Ebola patients. At first, Ebola can look like a normal infection. Symptoms may include fever, weakness, headache, muscle pain, sore throat, but things can rapidly become severe. Patients may develop severe vomiting, diarrhea, dehydration, organ failure, internal and external bleeding in some cases. The virus attacks the immune system and damages blood vessels, making it hard for the body to survive. Once Ebola enters the body, it multiplies aggressively. It overwhelms immune cells, spreads through the bloodstream, and damages organs like the liver and kidneys. The body enters a dangerous inflammatory state, blood pressure drops, and patients can go into shock. Without fast medical treatment, survival becomes difficult. There is no simple, magic cure for Ebola. But today, doctors use IV fluids, oxygen support, medications, intensive monitoring, vaccines in outbreak areas. Early treatment greatly improves survival. Preventing Ebola involves avoiding contact with infected body fluids, proper protective equipment, isolation of infected patients, fast outbreak response. Ebola may be terrifying, but science, fast medical response, and public awareness have helped save thousands of lives. Understanding the virus is one of the best ways to stop fear and misinformation. If you learned something new, subscribe for more real medical stories and health education videos. Because the human body is fascinating, and sometimes terrifying.